Can you reduce scoliosis? It is possible, and there are ways in which you can do so. We're looking at a person's spine here on the 25th of September and then also on the 23rd of November. So it's not a long period of time, but scoliosis is one of those things that's thought to be incurable. And we can see here that there is a curve, a gentle sloping curve in the lumbar thoracic spine of 12 degrees, and also a more accentuated cervicothoracic scoliosis convex to the left here of 26 degrees. Now, the question would be asked, what is pushing the spine in this direction? What is pushing the spine in this direction? And if we can come up with suitable answers that demonstrate that that 12-degree curve can drop down to an 8 degrees in 2 months. So that's a 4-degree reduction or 2 degrees per month, which is quite a sizable reduction. And you can see it's quite obvious that the spine itself is starting to reduce in the lumbar thoracic and also in the cervicothoracic. Now, what produces a head movement that goes that way and a body movement that goes that way? What produces a lumbar thoracic movement that goes that way and the hips that go that way? This one is a seated activity. This one is a carrying activity. So bag on the right shoulder there, bag on the left hip here will produce a flaring of the right shoulder blade, and it will actually lift the spine and tilt the head back to the center. Again, take a look at what it was prior, and now take a look at it. Again, just prior, you can see that exaggerated apex there at T3, and it's not as exaggerated in this photo here. So if we minimize these shots and bring them back into a comparison view, okay, so that gives you some idea as to how scoliosis can move. The answers come from the right questions. And here what I'm doing is I'm actually guiding as to what produces that sort of movement in this direction to cause the scoliosis, and what causes the shoulder to lift. What causes the shoulder to lift in this side, and what reduces that apexity at T3. Likewise, in the lower back, what produces the hips that move left and the body to the right, and then the upper body to the left. Again, guiding you in these processes can be done via Skype. If this is your area of interest, which is appearances, then we'll be able to see how we can guide your patients towards a straighter spine.